Hello everyone, today the topic which we're gonna study is Sjogren syndrome. Sjogren syndrome is an autoimmune condition in which there is a destruction of lacrimal and salivary gland. This destruction occurs due to the lymphocytic infiltration. Demographically, the Sjogren syndrome is more common in female and the mean age of occurrence is about 40 years. The Sjogren syndrome is classified into two types, primary and secondary. The primary is the idiopathic Sjogren syndrome, meaning that the Sjogren syndrome is not associated with other autoimmune condition. And the secondary Sjogren syndrome is a Sjogren syndrome which occurs secondary to other autoimmune condition such as rheumatoid arthritis SLE and a primary biliary cirrhosis. Clinically, the Sjogren syndrome primarily present with two manifestations. The first one is a dry eyes and the second one is a dry mouth. The dry eyes is also called as a Keratoconjunctivitis Sicca. The patient will present with the feeling of a dirt and debris in his or her eyes. Along with that, there will be a burning, redness and blurring of vision. The second one is a dry mouth. The dry mouth is also called as a xerostomia. The patient will complain of a difficulty chewing and dysphagia. Dysphagia is primary to a solid object. Apart from that, there will be a tooth decay and cavitation which will lead to bad breath. Apart from these two major clinical features, dry eye and a dry mouth, the Sjogren syndrome can cause other clinical features such as the vulvovaginal dryness. In this, there will be a vaginal dryness which will cause dyspareunia. The dyspareunia means that there will be a pain during sexual intercourse. The next clinical feature it causes xerostomia. Xerostomia cause dry scaly skin and it is predominantly on lower limb and axilla. Apart from these, the Sjogren syndrome can rarely cause arthralgia, vasculitis, Raynaud phenomena, interstitial nephritis, and any other connective tissue disease. After the clinical feature, now come toward the diagnosis of a Sjogren syndrome. How we will diagnose the Sjogren syndrome? Remember that there is no single diagnostic test for Sjogren syndrome. The diagnosis is usually based on a combination of a clinical feature and test. The tests which we perform are the antibody testing and eye, salivary gland and lip testing. So now we will talk about these tests. So the best initial test for the diagnosis of Sjogren syndrome is a Schirmer's test. This test is used to determine whether the eye produces enough tear to keep it moist. The test is performed by placing a filter paper inside the lower lid of the eye, and after 5 minutes the paper is removed and test for its moisture content. Secondly, the most accurate test for the diagnosis of the Sjogren syndrome is salivary gland biopsy. Predominantly lip and parotid gland is used. It is the most accurate test, but it is usually not performed for the diagnosis. Apart from these two, there are certain antibody tests which are performed for diagnosis of a Sjogren syndrome. The first one is an anti-nuclear antibody. This test is present in about 95% of our cases. It is highly sensitive but it lacks specificity because the anti-nuclear antibody are present in wide variety of diseases. The second one is the anti-Rho antibody. The anti-Rho antibody is also called as SSA antibody. This antibody is produced against a Rho antigen. It is present in about 55% of a patient. The third one is the anti-Law antibody. It is also called as SSB antibody. This is antibody produced against an La antigen. It is present in about 40% of a patient. Apart from these antibody, the rheumatoid factor is also positive in Sjogren syndrome. It is present in about 50% of a primary cases and 75% of a secondary cases of a Sjogren syndrome. Now come toward the treatment of a Sjogren syndrome. Remember that the Sjogren syndrome cannot be cured, but at the same time it does not reduce the life expectancy, so it need a lifelong management. The first line therapy for Sjogren syndrome is behavior modification. In behavior modification, we will maintain a good oral hygiene and we will use an artificial tear. Along with that, we will use a small sip of water and avoid the desiccant such as coffee. So all of these will help in preventing dry eye and dry mouth. Apart from that, we can use a secretagogues. Secretagogues are muscarinic agonist and they increase the body secretion. Primarily, we use a pilocarpine, but it is an older drug. It is replaced by a civimelline, which is a newer drug and used in the treatment of Sjogren syndrome. So by this way, we increase the secretion and prevent the clinical manifestation of a Sjogren syndrome. Apart from these, if a patient have a connective tissue involvement, we can use NSAID, steroid and immunosuppressant. At last, we will discuss the incidence of a B-cell lymphoma in Sjogren syndrome. As in Sjogren syndrome, there is a lymphocytic infiltrate, so it increases the risk of a B-cell lymphoma, predominantly non-Hodgkin lymphoma, and it involves a marginal zone lymphoma. So, a patient of a Sjogren syndrome, if it present with a unilateral swelling of a gland, so the most highly suspicion should be for the B-cell lymphoma, and it is the most common cause of death in a Sjogren syndrome. So it was all about the Sjogren syndrome. If there is still any question, you guys can ask, and stay tuned for more update.